Chapter 15, the autonomic nervous system, screencast 3. And out of our textbook, this will be section 15.6. And the topic is going to be neurotransmitters and receptors of the autonomic nervous system. This is probably going to be one of the most important parts of the autonomic nervous system, as we will be discussing much of this throughout the length of the course this semester. Now, when we look at the neurotransmitters that are primarily involved with the autonomic nervous system, there are two of them, and they are acetylcholine and norepinephrine. It does not matter. These neurotransmitters can either result in excitation or inhibition, and it is dependent upon the receptor. And that is an important thing to keep in mind. Whenever we look at a chemical messenger reacting with a receptor, it's going to be whatever happens once that receptor is activated, resulting in the change in cell activity. When we look at cells that are releasing acetylcholine, we refer to them as cholinergic. If we look at examples of cholinergic neurons, what we're going to be looking at will be all of the autonomic nervous system preganglionic neurons, all parasympathetic ganglionic neurons, and then if we look at sympathetic ganglionic neurons that are innervating sweat gland and blood vessels in skin, not skeletal muscle. We'll talk about that later. They are not going to be cholinergic. The target cells will have cholinergic receptors. And on the other side, if we look at a cell that is responsible for the release of norepinephrine, those are going to be adrenergic neurons. Most sympathetic ganglionic neurons are androgenic, and the target will have these adrenergic receptors. Now, this particular diagram is probably one of the most important diagrams that we're going to be looking at throughout that has an impact on this chapter. The first thing that I want to point out is this parasympathetic pathway. Now, if we look at all of the preganglionic neurons, it does not matter what branch of the autonomic nervous system we're talking about, we are going to see they all release acetylcholine. That's important. So all preganglionic autonomic neurons are going to be cholinergic, and they're going to release acetylcholine. We will also note that they are binding to nicotinic receptors, and we need to keep in mind that nicotinic receptors are excitatory in nature. And that makes sense because we want to make sure that the signal from the preganglionic neuron is going to make its way to the postganglionic neuron and to the target. Now, when we look at postganglionic neurons, now we're actually going to be looking at a difference with respect to what branch of the autonomic nervous system is. So let's take a look at the postganglionic parasympathetic neuron, and notice it also is cholinergic because it's releasing acetylcholine. Now, if we look at the target, look at the type of receptor here. Those are muscarinic receptors, and what we want to think about the mechanism is a little bit more complex, but we want to think of the muscarinic receptors as those suffering an identity crisis. They can be excitatory or inhibitory, and that's going to be dependent upon the target. Now, I'm not going to spend any time looking at the first example of the sympathetic pathway, and that's because it's cholinergic, and I don't really want you to think that this is a very small amount of sympathetic innervations. So keep in mind, I'm not going to put a lot of emphasis on that. I do want to put emphasis on the middle pathway because this is going to be the most common. And what we're going to look at here, note the postganglionic neuron. It is not cholinergic. It is adrenergic because it's releasing norepinephrine. And we were actually going to see that norepinephrine binds to adrenergic receptors on the target. Another really important branch or innervation pathway of the sympathetic nervous system is going to the preganglionic neuron that will actually go to the adrenal medulla. And this is important because this is the sympathetic innervation that is going to be responsible for the release of epinephrine, which is the primary hormone associated with the sympathetic nervous system. Now, going back to receptors, the first receptors that we are going to address are those that are cholinergic. And remember, these are receptors that will bind to the neurotransmitter acetylcholine. The subtypes are going to be nicotinic and muscarinic. When we look at nicotinic receptors, those are going to be found on all ganglionic neurons and adrenal medulla cells. These are going to be excitatory, so that's an important characteristic to keep in mind about nicotinic receptors. They will always be excitatory. You may remember these from the neuromuscular junction and the motor end plate when you looked at the contraction of skeletal muscle, and the motor neuron is releasing acetylcholine and binding to excitatory receptors, nicotinic, that will result in muscle contraction. Now, the underlying mechanism, when acetylcholine binds to a nicotinic receptor, it is going to open sodium channels. So now sodium will move into the cell. You're closer to threshold, and this is going to result in the cell depolarizing. And so we refer to this as an excitatory postsynaptic potential. Now, an example that we might want to think about is what happens when receptors at the neuromuscular junction are blocked. An example is curare, and what we're going to see, the receptors on the ganglionic neurons are not when we look at that. Now, muscarinic receptors, these are found in all target organs of the parasympathetic division, and we're really not going to address where we find them with respect to the sympathetic division. Now, one thing that I want us to remember, depending upon the target, these can be excitatory or they can be inhibitory. So that's an important thing to keep in mind. And remember, I refer to these muscarinic receptors as having an identity crisis. Sometimes they're going to be excitatory, other times they're going to be inhibitory. But what we really have to remember is the fact that they are always going to oppose each other. So once again, you have to make sure that you have parasympathetic receptors that will be excitatory or inhibitory, as it has to oppose the sympathetic nervous system. Now, when we look at norepinephrine, this falls under the category of a catecholamine. And what we're going to find that norepinephrine and epinephrine, another catecholamine, they both are going to bind to adrenergic receptors. Norepinephrine and epinephrine are the neurotransmitter and hormone primarily associated with the sympathetic nervous system. Now, when we look at adrenergic receptors, we're going to break them down into alpha and beta. Now, generally speaking, when we look at alpha receptors, they are generally going to be excitatory when norepinephrine binds to them. Beta receptors may be stimulated or inhibited, and we'll see that there are different classes of beta receptors. Now, the alpha receptor that I want you to be most comfortable with are the alpha-1 receptors. These are going to be stimulatory, and we're going to find them on most smooth muscle cells. So let's think about most blood vessels, specifically those that are going to the organs of digestion. That's going to result in vasoconstriction. If we look at the erector pili, those are goosebumps. If we look at the uterus contraction, ureters, internal urethral sphincter will be closing, but also we have pupil dilation. I'm really not going to spend a lot of time or hold you responsible for alpha-2 receptors. Now, if I had to pick a class of receptors that I think are critically important to the understanding of the material covered in AMP2, it's going to be beta receptors. Now, remember, it's all about the receptor. Once the receptor is activated by the appropriate chemical messenger, we will see some change in cell activity. When we look at the beta-1 receptors, we want to consider them to be primarily stimulatory. They are located on the heart, and when norepinephrine binds to these beta 1 receptors, we will see an increase in heart rate and force of contraction. When we see this stimulation happening within the kidneys, we're going to see renin secreted, and that's an important chemical messenger that will be involved in the renin-angiotensin system, and we'll come back to that when we study chapter 25. Now, the beta 2 receptors, these are going to be inhibitory. And the places where I want you to make sure that you're very comfortable with they're located is going to be smooth muscle, vessels to the heart, liver, and skeletal muscle. This is important because what this means, we are actually going to see vasodilation, bronchodilation. That is important, okay? And when we get into their action, one of the things that we're going to see is overall how when we have sympathetic activity, we're going to see increased vasoconstriction to organs of digestion because of the alpha receptors, and we're actually going to see vasodilation in vascular smooth muscle going to working muscle, and that's going to result in vasodilation. So basically, the interaction of alpha and beta 2 receptors is responsible for the redistribution of blood flow during exercise. We're not going to spend any time talking about beta 3 receptors, so you are not responsible for those. Now, an example in how epinephrine is used in a clinical situation is when we talk about an asthmatic. Asthmatics basically will have on their body a rescue inhaler. And basically, when they have an asthma attack, it's going to narrow the bronchioles. Now, when we look at the bronchioles, that is one of the places where we have beta 2 receptors. Epinephrine will bind to the beta 2 receptors, and remember, it's inhibitory, and that is going to result in bronchodilation. So when you see someone using their rescue inhaler specific to an asthma attack, really it's an analog to epinephrine. That's really what it is. It's binding to those beta 2 receptors and basically resulting in relaxation of the smooth muscle in the bronchioles, making it easier for for air to move through the bronchioles.